Very, very happy Nursing Week to each and every one of you. And we did kick off Nursing Week in the morning with the fabulous event for the 7 candidates running for elections. And what was the most inspiring to me was the camaraderie, the friendship, the togetherness that really they share, regardless of which party they were running. And the good news, I will tell you a secret, that at the end, we spoke about forming an interest group of Rneo. Yes, it's going to be called whatever they want, but the gist of it is nurses in politics, whether nurses that are already in politics, and there are several, we learned, or whether there are aspiring colleagues that want to join the ranks of politics. And the webinar was all about what make them make that additional move, you know? So politics as a career choice. It was beautiful to see that all of them continue to work as a nurse. So that was beautiful in a variety of sectors. We also learned that several of them have run more than once. They have run for federal government, for provincial government several times, some of them. We have a trustee, one that has been 8 years a trustee. So it really was tremendous. Now, I think that today is also the first day for Anu Thakur. Is that true, Anukul? Welcome. So Anukul was first on the other side of the fence. He was a reporter calling us to interview us. Now Anukul has joined Rneo. So here you go. Welcome to Rneo, and we're delighted to have you with us. Similarly, I think Raul Pinto is here with us today. He also was on the other side of the equation. Maybe that's what we do at Rneo, you know, when we have reporters that are, you know, on the challenging side, on the interesting side, we say, oh, join us. In any case, the numbers continue to grow and will continue to go throughout the event. We had about 67 in the morning for the Nurses in Politics session. And we are now already surpassing the 52. So let me first thank Susan and Tim for organizing the webinar, and also to thank the many Rneo staff and also members who are either participated this morning or are about to participate in the next several days in events. And of course, when I say staff, I involve the policy staff, the IABPG staff, the comms, communication staff, my office, absolutely really everybody. Of course, also membership and everyone else. So let's put the next slide, Susan, so we can do the land acknowledgement, and I will give you the honor, please, Susan.
Sure, thank you. Yes, so we would like to begin today by acknowledging that our work and the work that you are doing, that you're carrying out, takes place on traditional Indigenous lands all across Ontario. And we want to acknowledge that the actual Rneo office is located on traditional and unceded territory of the Huron-Wendat, the Haudenosaunee, and most recently the territory of the Mississaugas of the Credit, and that's Treaty 13. And this treaty, or this territory rather, was subject to the Dish with One Spoon Wampum Belt Covenant. And that was an agreement between the Iroquois Confederacy and the Ojibwe and allied nations, and that's to peacefully share and care for the lands all around the Great Lakes. And so we recognize that all of you are located on traditional lands across Ontario. And today that this land is home to many First Nations, Métis, and Inuit people all across Turtle Island, and that we're really grateful to have the opportunity to live and work on this territory. And at Rneo, we believe that we are all taking a part through land acknowledgements as an act, that this is an act of reconciliation, and that we must do our part towards reconciliation, and that it's important to honor the land and Indigenous heritage that we are on, that dates back to over 10,000 years. So if you are wanting to learn more about the land that you work or live on, we recommend that you go to this website that's here on the screen, nativeland.ca. It's an interactive website, and you can learn more about your land, the land that you're on. So
thank you very much, Susan. I do want to share that alongside the land acknowledgement that we do, is a time for reflection. And it's great if each one of you can reflect on it. I too come from Treaty 13, and I was sharing this morning that I often reflect what are concrete actions we can take towards truth and reconciliation. And given that now is elections, and given also that so much is going on in our Indigenous communities, one of the ways that you can support, and it's actually advisable when you study about truth and reconciliation and land acknowledgement, to do concrete actions. One concrete action that is recommended is to invest financially in whichever way or capacity that you have in Indigenous communities. So ways you can do that, and I am talking by having done it, is to support people that are Indigenous people that are running for elections, provincially, federally, in your own communities, for wherever, right, wherever. Another way is that when you need to do gifts, yes, of course, you can buy nursing gifts per se, or, you also can buy amazing, beautiful art done by Indigenous people. And that's one way to also honor and support the community. So I just wanted to share those thoughts. Back to you, Susan.
Thank you, Doris. So this is our plan for today's webinar. And just in a moment, Dr. Doris Grinspan, our CEO at Rneo, will walk you through Nursing Week, some of the activities we have for you that are for free. Then we'll dig into the rest of the webinar, which is divided into two main sections. And these topics really are showcasing or highlighting the work that Rneo is doing to address some of the inequities and system failures that were exposed during COVID-19, the pandemic. So we will start with the In Focus pages, and Doris will provide an overview of that, and then Harveer Punia and Deborah Badem will talk about the Black Nurses in Rneo in Focus page. Grace Suva and Rachel Raddick will talk about the Indigenous Health in Rneo page or in Focus area. And then Janet Chi will talk about the Long-Term Care Best Practices Program and Rneo in Focus page. And then the second half, we're going to have an interactive session about Rneo's provincial election platform. So Doris will provide an overview of the platform, just a kind of a short recap of that. And then members of our policy team are going to support you in breakout room discussions. We've got some great questions for those focus room discussions, and then get you thinking about ways that you might be involved in taking action and preparing for the upcoming election. And then we'll finish off today with final remarks and closure from Doris. So that's
and from any and all of you that want to comment.
Of course, yes, and questions and comments throughout. This session is being recorded, and if you're wondering if you want to share it with your colleagues after the fact, we do post it on our website, and including with the slides. So this is our overview of the week. Doris, if you want to tell people about what we're offering.
Yes, so thank you, Susan. We started this morning, as I said, with politics. What happened is, I want to tell you a bit the behind the scenes of how it happened. How is it that these things happen at Rneo? So we had prepared a wonderful panel of nurses in different sectors, in different roles, in different, cohorts of age. And then all of a sudden I said to my colleagues, well, how about the nurses in politics? We don't have them. And we thought, wow, we have 7 RNs running for all parties. How about doing a session about politics as a career choice? So here you go. That's how it came. And they delivered in spades. We could have had 2 hours and it would not have been enough. So Susan, we do have, I don't know if you were able to attend, we have a second idea for you on a future webinar, again with the nurses in politics, because one of the questions was for them, you know, how do you make sure, because all of them are working in nursing, how do you make sure the employer supports you? And all of them said every single employer has supported them. And I said to them, well, we need to hear how come every party supports you in continuing to work as a nurse. So that's a future webinar, which will be very interesting, because from what I know from our colleagues and from the various parties, every single party either has already or would support nurses to continue to work as nurses. And then of course you get curious, do doctors also get supported to continue to work on doctors and others in the health professions? I'm saying specifically in the health professions, because it's different than being an accountant or a lawyer, right? In a health profession to continue to work in the field. And it was just fascinating. It was beautifully done. It is taped, it will be shared. They were stars, every single one of them. And as I said, the silver lining and the cream at the top of the cake was how much they supported and really celebrated one another. So that was this morning. And now we have, then what we have is this session. Next tomorrow, what you will have is RN careers, led by our team, including one-to-one resume reviewing. And we have like 17 of our colleagues ready to help you shape resumes. So whether it's for you or whether it is that you know other people that are seeking employment in nursing, tell them that they can come to this session, they can still sign on, and they will have tremendous, every single year. The session on one-to-one resume writing is fantastic. Dolores Serrani, our senior manager of HR, alongside every single department and many of our colleagues on the front lines of Rneo and in other places, will lead you through the one-to-one resume review, and it's a privilege for us to help. And if at some point you want also one-to-ones, interviewing skills, by all means, we can also do that. Then, as I said, we have the careers in nursing, and you will have an array of nurse leaders in practice, in education, in research, as well as in management, all the way to presidents and CEOs like David McNeil, that will be joining and sharing with you where they have worked, why are they in the position that they are, et cetera, et cetera. So it should be a tremendously another inspiring and fulsome session. Again, one-to-one resume review on Wednesday, and that's because we know that the people that want are many, so we create more than one session. So that's for you in case you cannot attend the Tuesday, you can go on the Wednesday, and the same say to colleagues, share with colleagues, etc. Nursing Through Crisis, a comparison perspective, is a media conference that we are having at 10:30 on Thursday. It is the release. You may remember that we did a report in 2020, 2021 that we released in 2021. This is a report that is both international. So the comparison is international, it's across Canada, and it's across Ontario. In a nutshell, because I will not give you the results, let me tell you a couple of things. We have a challenge everywhere in the world with nursing. And the challenge is called the following: pandemic. The pandemic, if before we had the challenge with nursing human resources around the world and in Ontario in particular also, we did have a pandemic, and we cannot forget that. This is not only about politics and policy. We had a nasty thing and still have it that is called pandemic, and it has startled the profession hugely. So you will hear about the results of that report. Again, just as an advance notice, things are not getting better, and therefore the action needs to be even more urgent. So it's interesting. Some from CFRB just interviewed me before and said, if the premier was to knock at your door, what would you say is the key issue in nursing? And of course I responded. And I said, not only if the premier, if Andrea Orbath or Del Duca or Mr. Del Duca or Mark Schreiner, I will say the same to all of them, because whoever inherits the province has a pickle in their hands as it relates to nursing. They have a nursing crisis that is major. And because it's everywhere else also, it makes it even more challenging because everybody's trying to not steal, but have nurses, and they will have them from everywhere. So I spoke about the solutions, and on Thursday we will also share on Thursday programs that Rneo is releasing. And that session will repeat on Friday, and I will tell you in a minute what it is. Nursing Now Ontario Awards. This is the awards that are coordinated with WeRPN and with ONA and Rneo, and it recognizes an RN, a nurse practitioner, and an RPN. And of course, we recognize all of the RNs, all the RPNs, and all the nurse practitioners, and yes, all the students also. That are to become nurses, because it's not only because of the pandemic, that in itself is enough to recognize our colleagues, but they have given it all are depleted. And so this week, we need to put energy back into the field, guys. This week, we need to say to every single nurse that we meet and that we know, even if it takes one WhatsApp, one email, one tweet, one whatever, thank you. Thank you for being a nurse and for being there for Ontarians and for one another. So that's on Thursday, and you are all, as Susan said, welcome. No, except of registering, there is no fee to any of the events, so please attend. On Friday, we are going to see a tremendous session that is about leading with evidence and applying research in practice, and you will see a group of our team members presenting about the various ways that we lead with evidence, and also the various ways that you are already leading with evidence, as well as breakout sessions to do some interesting activities with you. And I'm not going to share details on that. So come and be there. And then we will wrap up on Friday at noon, sharing. Today, you're going to see two of the InFocus pages, and I will give a brief preamble of what it is. On Friday, you're going to see the release of the InFocus on nurses and well-being. And you will hear there not only what that InFocus is, you will also hear the various programs that we are launching, all of them free of charge, in relationship to nurses' health and well-being. So that's the program. I also want to say that we will be cobbling together a slide of all the activities that interest group and chapters are doing during Nursing Week. There are many events, including one this evening, that are tremendous events that chapters and interest groups have organized for members. They are open, of course, to their members in their interest group or chapter, but really it's virtual, right? So all of you can join those. So make sure to take advantage and get energy out of that. Next slide, please. So what's this InFocus? So InFocus is simply a way to bring everything that we do together at Rneo in relationship to a topic of priority. Many times, either we ourselves or we heard from others that, where do I find this? I heard about this, I can't find it. What's Rneo doing about that? So we decided to do exactly that, to bring in focus those areas that are top priorities of Rneo into 3 in focuses that you will see today, as Susan mentioned. And those 3 will be presented today, and then on Friday, another one, but there are all of the others coming, and we will be sharing with you. Is everything that Rneo has done or is doing in the in focus pieces, pages, themes? No, it's not. And it does not mean that other aspects that are not there are less important. What it means is that in these areas of in focus, we have done so much and are planning also to do so much that we decided to bring them into these in focus tiles. So you don't need to be thinking ever again, what is Rneo doing on this? What has Rneo done on this? What's the plan for this? And you can go to this on focus. The other reason why it's very important is because you can go there to see, well, is Rneo doing enough on this? Or you may just go to visit to see what we are doing, and you may discover that, wow, I wish Rneo was doing this on this in focus. You sent an email. You sent an email, and for us, it's also a working tool. It's a tool to find also areas where we can do more, or new areas within the in focus that we can explore and work with you. Next one, please. We lost the slides.
Yes, Doris, I'm actually going to pull up the in focus page.
Very good, thank you.
Yep, and then I've got it right here.
The tile where we have all of the in focus pieces.
Yeah, so here we are. You should be able to see that.
So in focus, and we can put on the side the article that my column that I wrote for the journal, because it really can help people share with others. Basically what it is, the in focus, you will see 3 layers. You will see a layer of Rneo, leave it there for a second, Susan, thanks. Rneo and health equity. You will see a second layer of health system transformation, and you will see a layer of leading change. Those are the 3 layers. And then within each layer, you will see themes, in focus themes. Each one of these themes has a theme leader so that they coordinate. It doesn't mean they do everything. For example, Grace Suba. Well, Grace is not a good example because she's doing almost everything on these areas, but no, she's a good example. Grace Suba used to do the piece on FINEP with indigenous communities. And then we used to have Sabrina Mirali, that is on beautiful mat leave, that used to do work with BPSOs that are indigenous BPSOs. And then we had the agreements that we have signed between my office and policy with chiefs. Grace Suba now is leading also the BPSO. I am advancing a bit your piece, Grace, and also the FINEP, but still it's various departments, right? It's various departments. So the same with the others. The in focus brings that theme leader is the one that organizes everything. So if you ever get lost, so to speak, when you go to in focus and you say, who do I write? Number one, you can always write to Rneo info, right? Or you can write to the specific team lead, which is the people that will be presenting today. Or if all fails, you can write to me, but if you do that and you don't want all fail, then you copy Michelle, because if not, it will be all fail again, because she is the one that looks at my emails. So we will triage you. Bottom line, you do not need to struggle to find out with whom we connect. We will help you connect. So the first layer is Black nurses and Rneo in the first theme on the first layer. The second is Indigenous health and Rneo. And the third one is 2S LGBTQI plus and Rneo, and that will be released on Pride Day in June. So that's coming, and it's coming soon, not because it's not completed, it's coming soon because we try to do that at times that is really important for the theme, for the in-focus theme. The next layer is health system transformation. And in that layer, you have, first of all, RNs and CNSs, and you have nurse practitioners and Rneo. We will not review those today, but if you were to want to be in charge or connect, Christina and Brenda, if you can put your names to your pages and you're the team leads, please put that there, people can connect, but do go and explore them. Those are very fantastic too. The next one, please. The next one in health system transformation is LTC, and LTC Janet Chi will be presenting today. Nurses health and well-being, Brenda will be releasing that on Friday with all of us, and it will be fantastic. And then mental health and addictions, another big theme, as you know, and Sabrina Morali will be in charge of that. The last layer, as I said, 3 layers, is leading change. And in leading change, in that layer called leading change in focus, it is the leading change toolkit, and it is all the events that we do to lead change at Rneo. So, you know, all those events that you have been involved, whether it's an action alert, or whether it is take your MPP to work, or whether it is Queen's Park Day, all of that is the way we lead change at Rneo. Next one, please. And I think we go now to our colleague, Susan.
Great, thank you for the overview, Doris. So what I'll do is open the Black Nurses and Rneo webpage, and Javier, I'll just scroll down on your behalf, okay?
Great, and then I understand that Deborah is involved
Deborah's
also.
here.
I just want to make sure that introduce Debbie, because we have several Deborah. So Debbie, allow us to call her Debbie. Debbie, would you like for just 2 seconds share your background and your PhD, and just so that people can put face and name? Because Javier will be presenting, I understand. So I want to make sure that people know that you are involved with us. Thank you.
Okay, thank you very much. Hello, everyone. My name is Deborah, and I recently joined Rneo as a guideline development methodologist, anti-Black racism focus. So I'm a second-year PhD student in nursing at U of T, and my research is on cardiovascular health of women of African descent in Canada. And I'm also involved in developing anti-racism pedagogy curricula at Dalalana School of Public Health at U of T. And I also volunteer as Director of Research and Policy with the Canadian Black Policy Network. And Rneo is keen in dismantling racism in nursing to be a part of this work. Thank you.
And we are thrilled to have you at Rneo, Debbie, and just a privilege to work with you. Thank you. Back to you, Javier. And just so you know, Javier has been the key person developing the InFocus and also working with the task force and with me on the report that we released. She will be sharing that with you, and Javier slowly is handing things to Debbie. Thank you so much, Javier.
Thank you, Doris. Hi, everyone. Welcome and happy Nursing Week. So thank you for the introduction. My name is Javier, and my current role is an implementation science manager with the IABPG team, and very grateful to have worked alongside Dr. Grinspoon and the Black Nurses Task Force on the recent release of our groundbreaking report, and which unveiled recommendations to tackle structural racism within the nursing profession, regulatory bodies, associations, and the broader health system. And another aspect of my role on the side is also as a best practice spotlight organization coach and champions workshop facilitator. And of course, as Doris mentioned, we are now so excited and really honored to have Deborah with us leading this work moving forward. And Deborah, please feel free to jump in anytime. So to provide an overview, a fundamental way in which the Black Nurses and Rneo health equity theme, integrated work, and Rneo's ongoing commitment to it is being highlighted is through the launch of this In Focus webpage. So we have a structured approach. The webpage showcases really the roadmap of the journey, including the history or trigger for our work on anti-Black racism, also the role of past presidents and members in leading this work, our partnerships, policy and capacity building efforts, and engagement we're getting in both mainstream media and social media as well. So we'll provide an overview of the content of this In Focus page today, but also, of course, encourage you to visit it and explore it to get more in-depth richness of this work. And we highlight, of course, key accomplishments and the future of it as well. So to start, many of you know, but since its inception of the task force in June 2020, the Black Nurses Task Force remains committed to addressing and tackling anti-Black racism within the health system. And of course, workplace settings, academic institutions, professional associations, in partnership with Black members, colleagues, and their allies in taking action. So we highlight in our banner there, transparently, that after the murder of George Floyd and the global expansion really of the Black Lives Matter movement, Rneo was prompted to reflect and take immediate action to confront systemic racism within the nursing profession. Since then, the work has grown quite a bit, and you'll see that highlighted in this webpage. So we can comment on the members leading change section there. So first, Rneo has a proud history of having Black presidents, and we wanted to showcase their contributions to our organization. They have been and continue to be leaders in education and policy in the nursing community. So we wanted to take a moment to highlight their successes. The task force co-chairs are Dr. Angela Cooper-Brathwaite and Cressida Garaway, nurse practitioner. And Cressida, I think I saw your name here with us today, so please feel free to also jump in. And the task force, of course, had 15 other nurses and nursing students from various backgrounds and sectors of the healthcare system. And again, it was really formed to move beyond solidarity and interrupt complicity to promote transformational change. And the task force immediately recognized an urgent need to take action, worked collectively to explore and share the experiences and the lived experiences of Black nurses, engage in political advocacy, and demand action. So this final report, which has been released and is housed here on this website, really shares key findings from an Ontario survey that was 205 members, Black nurses participated in, as well as 19 important recommendations, which really these recommendations we say had two goals in mind. First, to address current problems in the nursing workplace and academic settings, and then work to extinguish all anti-Black racism within the nursing profession. These recommendations have implications for health systems and health systems transformation globally. So this report is housed here. Please feel free to go explore that as well. And then Rneo and the task force gave great thought to sustainability and how to continue to capitalize on this great momentum that we've created. So the Black Nurses Leading Change Interest Group with co-chairs Daria Judy Hope and Dania Versailles was created to intentionally support integration within and external to Rneo. So this webpage will highlight key partnerships and engagements. So you'll see such as celebrating Black History Month, observing Black August, but these will be updated. As Doris mentioned, this is a live page. So key partnerships and engagements will be updated on an ongoing basis. We have also been advocating for policy level change. So right after, I believe we highlight our position statement on racism, as well as a letter to the College of Nurses advocating for race-based data. So this section, again, will also continue to grow and be updated as we continue to engage in political advocacy. So really, we highlight key partnerships and engagements, and we highlight capacity building as well through our past webinars, and we have a library for easy access. And you see various engagements, again, in traditional and social media. So you'll see Dr. Angela Cooper-Brathwaite's article highlighted here, as well as tweets by Dania Versailles. So again, giving a space and platform for Black voices is really the focus of those sections. And you'll also find internal work highlighted here that is being done within our organization, within the Rneo, because we also need to focus on that as well. So by visiting this webpage, members and users from the larger community will be able to have easy access to all the content and collective work, and Black Nurses Leading Change interest group activities, and our progress within our recommendations as well. And going forward, it'll also allow us to reflect again on what we're doing well, identify learning opportunities, future partnerships, and one dedicated space. So we also encourage you to read through the report, visit here, this link, and I'll post a link to our action alert, and we encourage all provincial party leaders to be an ally and add the Black Nurses Task Force recommendations to their election platforms. And because this is the live page, just wanted to say one more thing, that we're actively seeking feedback on the experience of end users with this webpage. So please feel free to share that with us as well. Thank you. And Deborah, Cressida.
Beautiful. Just 1 minute. I want to highlight your tremendous role, Javier, in helping us lead that. I want to highlight in particular also Angela and Corsita's role in leading the task force. I just posted there the 2 articles that we published in Nursing Inquiry, which is a very, very tough journal. The 2 articles are in 2 separate issues of the journal. Both issues were dedicated fully to systemic racism, BIPOC at large, and then other areas, including, of course, Black nurses within that, but also others. So I encourage you to look at those 2 issues because they're tremendous. I know, Deborah, that because you have done also some work, you may want to highlight others later on. I'm encouraging not to use a lot the chat now because people say it's distracting, but those pieces come directly from the task force. So that's why I wanted to highlight, and then we can all, Javier can, Deborah can, Corsita can, Angela can, we can guide you to more write-ups. If you look at the task force report, there is a tremendous amount of literature there, magnificent. Corsita, I don't know if you would like to add anything, and Deborah, if you would like to add anything. Debbie. Corsita.
Hi, good afternoon. I'm muting myself. Can you hear me?
Yes.
Thank you for the invitation. It's great work. I'm very proud of the work that has gone on. Thinking for 2 years, it's been, quite fast. So, I mean, it's been a lifetime, but in the last 2 years, we've seen so much progress. So I am very proud and honored of the work that's been going on. I'm very proud of the Rneo hiring Black leaders to champion this work. And I look forward to seeing where it all ends up. And I'm hoping that this will definitely foster change for Black nurses in Ontario, and in Canada, and for Black patients. Because ultimately, when Black nurses have a good education, have access to many things, it means that Black patients have access to many things. And ultimately, it means that all of Ontario has access to excellent things. So that is that's my joy, and the committee that we're working with, it's a tremendous group of people who are quite dedicated, and I enjoy working with everyone. I enjoy working with Javier, and listening to her present today is, it's always heartwarming. Welcome again, Deborah, to the team, and just so thrilled for everyone to be here. Thanks a lot, and thanks, Doris, for your work.
Thank you. Thank you, Corsita. I would ask that people put the phone on mute, please, because the clicks are probably interrupting the people speaking, if you don't mind. Debbie, anything you would like to add with fresh eyes to all of the tremendous work already in progress?
I just want to reiterate what Cosita said. This is tremendous work, and a lot has been done. Yeah, and I'm happy to contribute to the further work that will be done on this topic as well. Yeah.
Fantastic. We know that you will help it grow even further. Thank you so very much. And thank you, Herbie, a fantastic presentation. Thank you. I think we now have Rachel, I believe.
Yeah, Grace.
And Grace. Apologies.
No problem.
I know that Grace chuckles there. So thank you. Grace is actually, just so you know, Rachel's mentor. Okay, go for it, Grace and Rachel.
Okay, well, thank you very much for joining us today and happy Nurses Week. My name is Grace Suva and I'm the Senior Manager for the Indigenous Health Program. And I'd like to introduce you to Rachel Raddick, who is the Manager of the Indigenous Health Program. Did you want to say or share anything else about yourself, Rachel?
I want to say how we stole her. So Rachel, and that's why she is so much profile there. If she had been a staff of Rneo, she would not have been that much profile. Probably at least would have been Grace next to her. But Rachel was the founding leader, so I want to say that because she might not say it, of the Indigenous Nurses and Allies Interest Group. So go for it, the two of you.
Miigwech, Doris. Yeah, I don't think I have anything else to add to that, Grace, if you want to go ahead.
Okay, no problem. So the Indigenous Health and Rneo webpage is a public platform that showcases the collective efforts of the partnership work that Rneo has been engaging with Indigenous partners on areas of priority for Indigenous health. So for us, it started as a project in terms of being able to coordinate and being able to identify what collective work are we doing within the organization. And in being able to coordinate, we're able to leverage the partnerships as well as work with each other as we go along and work with various Indigenous partnerships and expand that network to be able to advance on the collective work to ultimately advance our work on the Truth and Reconciliation calls to action. And if you can scroll down, Rachel will talk about the residential schools position statement.
Thank you. So the Rneo is very involved in advocating for Indigenous health and the wellness of Indigenous folks across Ontario. And one of our key areas of focus is the recovery of children on residential school grounds and calling on existing government structures to take action. And the Rneo's nursing policy analyst team works very hard to keep these position statements current and in line with Indigenous issues at the national and provincial levels. And if you can scroll down just a little bit, there we go. So I know there was already mentioned about the Indigenous Nurses and Allies Interest Group, so INAG, but INAG is an interest group within the Rneo that focuses on creating culturally aware spaces for Indigenous nurses and allies to connect and discuss in ways to improve and advocate for Indigenous patients, families, and nurses. So if you are interested in learning more about INAG, you can follow the links to learn more about the interest group.
Excellent. Thank you, Rachel. And so when it comes to members mobilizing change, it's nurses such as yourselves who are coming together to be able to advocate for Indigenous health. And so back in 2021, these are AGM resolutions that were put forth and include such recommendations such as the integration of mandatory studies, courses in nursing schools, as well as the thoughtful integration of the voices of elders and elders as part of the healthcare team. We also, again, as you see there, blazing new trails as student leaders. We have Indigenous youth such as Rachel, who was then the chair of the Indigenous Nurses and Allies Interest Group, as well as Chantel. And they did a presentation, again, highlighting the advocacy work that they do, as well as youth as important leaders in being able to support and take a lead in Indigenous health and in the future. When it comes to partnerships, none of this work would be possible without partnerships with Indigenous organizations, Indigenous individuals. And one such partnership is Roseanne Archibald. She is now the current National Chief of the Assembly of First Nations, but she was then the Ontario Regional Chief of the Chiefs of Ontario. And it was then that she had approached Doris saying, we need to do something. And this was during the first wave of the pandemic, a pandemic plan template that is able to provide that support and guidance for Indigenous communities in Ontario. And so we collaborated together with Anishinaabe as well as staff from Rneo, Policy Department, Doris, Roseanne Archibald, as well as Chiefs of Ontario, to be able to develop a pandemic plan template that either can be used to augment the work that was currently being done in terms of pandemic planning in Indigenous communities, or if there wasn't a plan in place at that time, that was almost 2 years ago, to be able to have the opportunity to implement one that reflected the best evidence in regard to public health measures at that time. We also have a number of partnerships, formal partnerships, again, with Anishinaabe Nation, as you see there. And if we scroll down a bit further, we also have the best spotlight practice organizations. And we have 6 fantastic Indigenous-focused Indigenous-led BPSOs who are well into their 3rd year in regard to implementing and really harmonizing the Rneo BPGs once they have selected that resonate with the priorities of their communities with traditional wise practices and ways of knowing and being. And so as you see there, the organizations are Sandy Lake First Nation, Mamaway, Chickimik, Anishinaabe Mushkiki, 7th Generation Midwives Toronto, and the Ontario Native Women's Association. And later this month, we are fantastically happy to welcome 2 new Indigenous focused BPSOs to the BPSO Collective. And they are from Shibogama First Nations Council, as well as Southwest Ontario Aboriginal Health Access Center. We also have, as part of the BPSO OHT Collective, the first Indigenous focused led BPSO OHT, and that is with Mamwe Singh. As you scroll down a little bit more, yes, maybe just scroll up a little bit more. I just wanted to show you right there. In terms of the ways in which we disseminate and bring an awareness to the collective work that is being done with partners. So as you see there, very much celebrated Green Amicus and team from Sandy Lake First Nation, part of a BPSO collective, the first Indigenous focused BPSO, and they have been fantastic and won an award as Friends of a Recognition of Rneo Award, and which they have been very successful in leveraging the implementation of the Person and Family Center BPG within the context and the setting of a Sandy Lake First Nation within the community, and have also leveraged that in order to be able to facilitate vaccine clinics, contact tracing, etc. So really being able to keep contact and continue to support community based on their priorities. We also have there, for example, your Take Your MPP to Work, in which Chickimik and Mamaway, again, another 2 BPSOs, had shared their work to support Indigenous health at your Take Your MPP to Work. And those were events that will continue on every year. If you scroll down a little bit further to Rneo policy, right there, the policy work is very much complementary and as important as the practice work that is being done at Rneo. So the policy department, likewise with Rachel and I and Tanya as part of the Indigenous Health Program, work closely with partners such as the Chiefs of Ontario and Anishinaabe Nation to support mutually identified Indigenous health priorities and ultimately Indigenous people's right to self-determination and self-governments. And so there are various Rneo policy documents that have been released, such as the NP Vision for Tomorrow, in which one of the recommendations is mandatory cultural safety training in NP schools and nursing schools, as well as Rachel had also previously mentioned is their position statement on residential schools children. And you'll hear more about the Rneo's provincial platform, but also there's the integration within those recommendations, Indigenous health priorities. So such as the creation of an Indigenous urban-led and rural Indigenous housing strategy, working with the federal government to ensure the 94 calls to action of the Truth and Reconciliation Commission are implemented. And you'll hear much more about these recommendations when we talk about the policy platform a little later. I'm going to pass it on to Rachel to talk about capacity building.
Thank you. So with capacity building, currently the Rneo works in partnerships with Indigenous stakeholders and organizations to create and facilitate a series of Indigenous-led webinars that are geared towards educating healthcare providers about Indigenous ways of knowing and being. So you can see that we have many different webinars that are posted and recorded here, and those webinars are created in collaboration with our various partners across Ontario and nationally, and youth organizations and Indigenous youth elders and knowledge keepers. So we make sure that we are working really closely to share that knowledge in a good way for our healthcare providers. If you could scroll down just a little bit. Yeah, so with our best practice guidelines, we are just in the final leg of our Indigenous focus best practice guideline, promoting smoking reduction and cessation with Indigenous peoples of reproductive age in their communities. So within the next few months, we'll be releasing this publication, which is the Rneo's first Indigenous focused BPG. So that's so exciting. And the purpose of this BPG is to provide nurses and interprofessional teams with evidence-informed recommendations on culturally safe and meaningful ways to support smoking reduction and cessation with Indigenous peoples of reproductive age and their support networks and communities to improve health and wellness. And yeah, if you could scroll down just a little bit there, perfect. So under our media section on the In Focus page, the Rneo uses social media to disseminate and generate more conversations and on and to advocate for Indigenous rights and Indigenous health. And examples on the In Focus page that you can see here are our National Day of Truth and Reconciliation and Every Child Matters posts that are here on Twitter.
And finally, similar to what Javier was saying in regard to Rneo staff leading change. Change starts within every individual staff as in the organization, and continue to work on integrating cultural safe practices and our policies and our practices in our daily work. And it's vital to be able to create the safe spaces for Indigenous partners with whom we collaborate with. So as you see there, that is a very nice Zoom picture of our first day reflection of Rneo staff on the inaugural National Day of Truth and Reconciliation. And so we ask ourselves, what does truth mean? What does reconciliation mean? What does it mean individually? What does it mean as an organization? And how can we meaningfully progress in regard to addressing the truth and reconciliation calls to action? So very much what Doris had said, it's the reflection and understanding and knowing the truth, as well as the action steps in regard to be able to further and to be able to support Indigenous health. So that is the end for the Indigenous Health at Rneo webpage. And again, please feel free to explore the page on your own and provide us with feedback, both on the content as well as the navigation to the webpage. It continues to evolve and we're very open to feedback. Thank you very much.
Thank you, Chimiwich, Grace and Rachel, very much so. To every tragedy, I think we are better off when we can find the silver lining. I think otherwise one as an organization and as people, get very depleted. You mentioned, Grace, that Chief Archibald approached me, and it's true, but it would have never happened if it was not for COVID. So this was, just so you know, in the very early meetings where were closed door meetings with David Williams, who was then the Chief Medical Officer of Health. And I was already in a state of heightened panic, I would call it, that if the virus got into any of the Indigenous communities, it will be an end for that community. Because, many of the communities live under extreme poverty. They live very far away from resources. Many don't have, the hospital next door and the this and the that and the other. And I basically, without knowing that she was there at the beginning, because she's a very gentle person, actually, very much the Indigenous way of being of people. I really, you can see that even in the way, Rachel, you are, and Grace, you as an adopted person that has worked for so long. And I'm trying heavily to learn from all of them on calming down. But I am saying this because you didn't hear Chief Archibald pushing that what was happening. And I was constantly challenging Dr. Williams. And that's why she called me one day and she called me to say thank you. And I couldn't believe who was calling me because like she was the big chief, right? And I had so much admiration from the outside for her work. And we became very, very kindred spirits, and the rest is history. But the rest would not have happened if it's not because of people like you, Grace, and Tanya, and Irma Jean, and Heather, and others that were involved in home office, that really, and people on her team, that, you know, when we put the idea of, you know, we are not going to wait for the feds or the province to do something to protect our Indigenous brothers and sisters, Indigenous people. We are not going, you know, just to sit and wait. And Chief Archibald was so ready to go with us, right? She didn't even know enough about public health, but she was ready to go, right? And the rest is history, because we never would have developed the tools that were developed if it's not because of the team of Chief Archibald also. From the content, which you guys put a lot of expertise, but they shape to really the way it needs to be for Indigenous people, to the artwork by which they describe, right? Indigenous people themselves describe. So it's a beautiful learning. It's a beautiful learning of how people can come together to really make things happen, as Rachel says, in a good way, for the people that need the services, because those services were short. And then I do need to give on this area, don't extend it to everything, but I do need to give kudos to the Ontario government, because it is one of the areas where the government here actually worked their butts off, in terms of doing things in a in a good way by listening to the community, right? We have May Kat, who is a tremendous nurse leader, one of my gurus on everything Indigenous, I would call it, a very seasoned nurse. And she was very involved with all the efforts of vaccination, how it should happen, and with the community. And the rates of vaccination amongst Indigenous communities, I think, is amongst the highest in the world. And it's only because they understood, the government here understood that doing it led by Indigenous peoples was the way to do. And the rest, right, Rachel, is magnificent. Not that there are no challenges, there are still some challenges in some communities, but it could have been a horror story, quite frankly. And I think, Grace, you have a similar experience with BPSOs, right? Not that we can go now into it, but I would like for you to issue an invitation to people to come to the webinars, if you don't mind. Put that on the chat so people can come. I attend every single one of those webinars, number one, because they are just fascinating, interesting. I learn a lot, and also to give my respects to the work that is being done. I mean, there are some that I have learned so much about practical things. It's not only about Indigenous people and Indigenous knowing and Indigenous ways of being. It's about practical things that many of us can adopt and be better off. So miigwech, Rachel and Grace, and to Tanya also, because she also put a lot of work into it, and everybody else in the team. Back to you, Susan, for LTC, I think.
Great, thank you. So the final in focus page that we'll look at, Janet Chi is going to present the long-term care best practices program and Rneo.
Well, I'd like to start with wishing everyone a happy Nurses Week. As Susan had mentioned, my name is Janet Chi. I'm the Associate Director for the Long-Term Care Best Practices Program, and I am so excited to share with you this Long-Term Care in Focus webpage. You know, this page is really a compilation of the strengths of long-term care and the dedication of the many members and organizations devoted to the care of seniors. And so let's start with our journey. This page is all about the fact that caring for Ontario seniors is one of the most important responsibilities that we have as individuals, as a community, and as a province. Everything on this site is linked to how nurses can provide the best care for our seniors and the tools to be able to achieve this. And so our journey is really an introduction to the long-term care best practices program and how we at Rneo can support providing quality of care for seniors. We then move along to a critical topic to ensure quality of care, which is the need for national standards for long-term care and Rneo's advocacy for national standards. Moving forward, we highlight the contribution of many of our numerous members, and in particular, I want to highlight two interest groups, the Long-Term Care Nurse Practitioner Council and the Gerontological Nurses Association of Ontario, both of which are active in advocating for nurse practitioners and high standards of nursing care. Members mobilizing change speaks for Rneo resolutions related to the long-term care sector. Partnerships and engagements shines a spotlight on the long-term care best practices spotlight organizations program and provides valuable videos and links for long-term care homes to learn more about how to be part of this wonderful global movement. The Rneo Policy Department consistently advocates for improvements in long-term care on various long-term care issues, standards, and legislation. This section highlights some of the key issues and documents with a link to learn more about the Rneo long-term care policy work. So I encourage you to go to these pages. The capacity building section, I have to say, is my favorite section. It's a compilation of resources for professional development, best practice guidelines, toolkits, and events. So I encourage you to come here, explore this section. There's so many resources for you here that are free and available for you to utilize. Project Impact highlights documents developed by long-term care homes showing the positive outcomes of implementing best practices in long-term care. And these are just wonderful documents because they can give homes ideas for how to make positive and lasting changes related to quality of care in your homes. And so come here and visit. We have many, many evidence boosters on many topics. Rneo Media highlights key stories and social media posts relevant to long-term care in the news. And the next to final section is the Rneo staff leading change, where long-term care homes can connect with a long-term care best practices coordinator in their region. And so we have 14 across our province. Connect with us. We would be happy to connect with you and support any of our long-term care homes. And finally, Careers in Long-Term Care highlights two websites, RN Careers and the Ontario government website, where nurses can search for career opportunities in long-term care. So I really encourage all of you to take some time, explore this page, and connect with either myself or a long-term care coordinator in your region to learn more about the programs and resources that we have available at Rneo. Thank you.
That is beautiful, Janet. And maybe just to give a little bit of an advance notice, we can do a whole webinar at another point on it, is that there will be a program related to clinical pathways and embedding those clinical pathways in electronic medical records. And Susan, that's another one that we can bring Rita and our colleagues at Point Click Care and Janet at a later point to present, because it will transform. You know, this comment from Janet, that the way we treat our older persons and other vulnerable communities is central to who we are as people or as an association. All we can say is that at Rneo, we are taking those very, very seriously and putting a lot of important investments to ensure that the future looks better than yesterday. So thank you, Janet, and thank you to the entire team. Thank you to Citlali that has been side by side with the program for many, many, many years, and to all the long-term care coordinators. And of course, the people in policy also that work in the area of long-term care, specifically on policy matters related to the 4 hours of care and the nursing care, the nursing care guarantee and other aspects. Great. So let's see if there are some questions, Susan.
Yes, there is a question from Karen, saying it's wonderful to hear that Doris believes our provincial government is working hard in many critical areas. Are you able to share with us if Rneo has worked directly with our provincial Minister of Long-Term Care?
Yes, significantly. And let me preface by saying the last 2 ministers, not only the last one. Very much so. In fact, the first call that the Minister Rod Felix made was actually to me, and I was honored and privileged to hear him. He is the one that understood quite fast the need for the clinical pathways. And yes, even though he left it with Minister Calandra, who has connected with me. I think I can count in one hand ministers or premiers, for that matter, past and present, that have not connected. So the question to that question is more, what are the outcomes? They all connect. The question is, what are the outcomes? And I can say in long-term care, and Janet can also say, and I know Rita, certainly, we are delivering. Is it enough? I mean, I spoke in the media about that today. We would like for it to be faster, not the issue of clinical pathways, because that will move relatively fast. And Rita that leads that, Rita Wilson, and our colleagues at Point Click Care are doing amazing, amazing work. But in the area of the 4 hours of care, in the area of more, of 20% RN, 25% RPN, no more than 55% PSW, not because we don't believe on PSWs, we respect and believe PSWs, but we do need more regulated staff. And on the area of 1 nurse practitioner per 120 residents, we would like to be faster. Minister Calandra and Minister Phillips, who is not minister anymore, by the way, he left government altogether. And even then got in touch, by the way. They did announce the 75 additional nurse practitioners. That funding is in the current budget, is not waiting for future, for results of elections, for example. So there is a process that they're developing. So when a government goes, your question now, let me expand a bit. And I think it's good, Susan, because anybody can read the platform. It's the exercise on the platform that is more important. But when a government goes, when a province or a country for that matter goes into elections, it goes into what's called the caretaker mode. That's an interesting title. And that goes for everybody, whether it's civil servants or whether it is politicians. But they do leave a person in charge because something can happen, right? So I am fully aware that the process for the nurse practitioners, just in case we have some, and I know that Beth is here, so she probably is posting it already in whatever Twitter and everything else, that process will continue, not waiting for elections, nor is the clinical pathways, another innovations that have been highlighted. Is it enough? It's not, but I pride myself in being very honest when I answer questions. This is not just the current government. The failures, and I'm not defending the current government either on saying this, the failures of long-term care precede this pandemic as the failures in nursing. It has been for decades. We put a report that you are welcome to look, is in the materials that Janet presented, of 35 reports. In fact, it's Heather McConnell that took the lead on that, and I hope Heather is here. I know she's working on some other documents, but she put the effort of looking at those 35 reports. Some of the recommendations, again and again and again, the same, regardless of what was the inquest, what was the inquiry, what was the big reports, guys. So it has been 20 years a disaster in the making until it came a pandemic. And I do not take pride in saying that that specific minister, Minister Fullerton, was shortchanged long-term care. She did shortchange in Rneo's view and my view as a CEO at the long-term care sector. But Minister Phillips and Minister Calandra have really engaged in a very different way. I am also both privileged and cursed. I say cursed because of the amount of time that you need to spend, nothing else, of being in many, many committees that the Deputy of Long-Term Care, Nancy, leads with a tremendous team. Janet has been involved in some of them. They are working 24/7. The civil servants are working 24/7 to turn long-term care into its head. The issue is this: we said it in the ECHO report, enhancing community care for Ontarians, which I would appreciate if someone puts that on the chat also, the 214, the 220. We did say that long-term care needs to connect as part of community care. Why? Because people want to live in their homes, right? Long-term care should be there when we as individuals don't have the capacity to be any longer at home, either because the resources are insufficient, the need is 24/7, and yes, we should be developing 24/7, as Manitoba has done, as BC has done. Well, it's not 24/7, but it's more visits per day than here, right? And it should be focused on community care, the philosophy of home, right? People want to live in their home. So the type of nursing homes go forward also should be not only these mega buildings that we have, but actually community type settings that enable, at the beginning, people of living together with a little bit of supervision. Then if it's really 24/7, moving to a place in a way that is not these massive buildings that they get lost. So a lot more work to do, but my gosh, we have 20 years to catch up. And with the leadership of Rneo, and Janet comes from the sector, has done absolutely all the roles in the sector. And with Rneo getting involved with whoever is the next government, next minister, we work on serving Ontarians. We don't work for any particular party, but serving Ontarians. And we will both work together with whoever is the next minister or the next premier, and also push the same that we have. We are not going to stop to push, because as a lieutenant general said to me when I got the Order of Ontario, and I was so impressed that they were inviting me to this thing, Dalton McGuinty was coming on board, and he said to me, give them help. All of them need help. All of them need help. Give them, push them, right? And he was not being partisan, right? He never should have said that. But I don't think they all need help, because I actually think the more you work with politicians, and this morning with the 7 candidates that we had, it's hard work. It's not easy work, guys. It's not easy work. I think we need to give them the support when support is required, and Rneo is always ready. We need to give them the applause when applause is due, like clinical pathways now and nurse practitioners moving along. And we need to keep pushing. We need to keep pushing, because I think we have, both in nursing and in long-term care, if not in all sectors. I think post-pandemic, we have a good 5 to 10 years of recovery, guys. We need to remember, yes, there were problems before. We also need to remember there was a pandemic. There was a pandemic. Whether you look at the BC with the NDP, or you look at Manitoba with PC, or you look here, or you look at another country, there was a pandemic. Could have we done better if we stuck more to only evidence? Yes. Will any politician do that? Now I'm saying I'm convinced that no, because it's parties across the spectrum that have not sufficiently listened to the evidence. If you look, even in this country alone, and watch it, because there will be federal elections too, will be federal elections, and this question that was just asked will be additional questions that we will need to be attentive, and nurses need to be engaged in voting, and we are moving to the platform, in voting, in demanding, in supporting, and also in applauding, guys, when applauding is due, because what was done for that particular piece, as small or as big as it is, was the right thing. So I don't know if that answers the question of the colleague that asked, but I'm willing to.
Yeah, and I think that we don't have any other questions right now in the chat box. And I think what you've just been saying is a great segue to the policy platform. And we've got 40 minutes left, which is certainly plenty of time for us to have our breakout rooms. And so Doris, if you can, in just a moment, introduce, say a few words about the policy platform. We certainly got the link to it. And we have our team members from our policy team who are going to support 4, maybe 5 if you want to take one, Doris, but at least 4 breakout rooms.
I would say we do 5. I will
5,
take
okay.
I say we do 5 because we have 55 people.
Okay.
And I want people to be able to interact.
Great. Okay, so we'll do 5 breakout rooms, and we have some specific questions that we will suggest that as a group you address whatever you want to address amongst those questions. And Doris, I'll just let you say what you wanted to share about the platform before we move into the breakout rooms.
So you can keep the pictures of our colleagues there, number 1, because all those pictures are beautiful, just beautiful. Let me comment in general how platforms get developed at Rneo. First of all, always we do 5 pillars. Since the moment I worked in the association, we used not to have a platform, but many years now we do. And the 5 pillars are the following. And I will tell you what changed this year and why it changed. First of all, we do the pillars of social determinants of health, environmental determinants of health, health system structuring or restructuring, basically health system, like nursing, health, human resources, and how we will pay for all of it. So you will notice that I said I said nursing, health, human resources. I didn't say nursing. Why didn't I say nursing? Because nursing is all of the above. Nursing is also social determinants. Nursing is also environmental determinants, because nursing is about first keeping people healthy. And then, as Tommy Douglas used to say, patching them up if they're ill. Because as he said, or Florence Nightingale, society failed them. Even Florence Nightingale said that at the time. She said, paupers are not paupers until we fix the ills of society, and then we will not have, she called them paupers, people asking for handouts. The only thing we did change this year is environment. We put it first because we have a mega crisis, guys, with the environment. Mega crisis with the environment. And for any of us not to understand that, it means we are putting a handkerchief in our eyes, because whether people live in the streets of Toronto or in shelters and in all the other tragedies. Or they live in mansions. Without an environment, there is no future. There is no future. And I'm not talking future generations anymore. I'm talking this generation. So if you think future generations, right, it's even worse. So that's why environment is the first prong in the platform. Then you have social determinants of health as the second prong in the platform. Then you have nursing, and then you have health system, and then you have how we will pay. So in a sense, the idea and the analogy was that nursing as a profession is holding together, right? And trying to tackle all of the above, trying to tackle environmental issues, trying to tackle social determinants, trying to tackle issues like substance use, which is a social determinant because it comes out of the situation of individuals, and also trying to tackle the health system that we will have in the future and enhancing community care. And in doing so, also needs to actually address our incredible challenges with nursing human resources. So that's why it's in the middle this time. And in that way, we're trying to represent all and how to pay for it. So I'm not going to go into details in the themes because you can read about that in the platform. And I think that you will be inspired. These are by no means the only issues. What's in our platform, especially on environmental and social determinants of health, is by no means all the issues we need to tackle. At least not from my perspective as a Doris Greenspoon. But as CEO, we could not and can never take everything that there is. So we focus on the aspects that Rneo can have more impact and more input. That doesn't mean that you in the breakout sessions could not say, you know what, on environment, I want this, and I'm going to get involved. And on social determinants, I want this, and I am going to get involved. But I think there is enough in the platform that can inform and can inspire every single nurse to get involved. So with that, I'm going to introduce the magnificent people that work with us. Lauren Bailey, who leads social determinants of health. Kim Jarvis, not here. I don't see him, and it's because his son came to visit from Vancouver, so good for Kim. Kim Jarvis leads with Matt, look, they're all away. Matt Galway, the director of Health and Nursing Policy, also is away. He's having a vacation in Italy. Good workplace that we enable people to do their thing. They're cycling, which is beautiful. 30 years anniversary, well deserved. Imagine Bainok, who is senior policy analyst, will facilitate also one of the sessions. Brenda State, policy analyst, she focuses on nursing. She leads the nurse practitioner aspect. And then Cristina Pulano, who works on care delivery and more. And Cristina did also, for Janet's sake, she did also in her own master's work. She worked on the area of long-term care. So another excellent link for us. And of course, Anne-Marie Morris, who makes the wheels go round and round and round like the song, and who really leads all the mobilization activities of Rneo in policy, whether it is take your MPP to work, which we are in the midst of. Well, now it's not that. Now it's take your candidates to work. Or whether it is the day at Queen's Park, or the Falls Tour, and many other activities. That's Anne-Marie. And we can get going, Susan.
Great. So these are going to be the breakout room questions. What issue or issues resonate most for you? Why is this issue so important based on your experience or your role in nursing? how can you make the issue resonate with voters? For example, you might consider which of the issues will resonate most with voters, or how can you or we best influence voters? Who should you target? And who will be readiest to listen to you? How will you be involved in the election, and how will you encourage others to be involved and vote? So you know, there's not enough time to answer all of these questions. We're going to start with 15 minutes and kind of just check and see how much more time might be required. But let's start with the 15 minutes. And Doris, I'm going to have you take Irma Jean's spot. So those are the 5 people who will kind of take, facilitate the breakout sessions, but we do want a lively
You can let Irma Jean do it. No need for me.
No,
Oh,
Irma
Irma
Jean's
Jean's
not able
not
to be
here.
here. Yeah.
Mhm.
Oh, sorry, apologies. Okay,
Yeah.
okay.
Yeah. So so those are the questions, but see where your group gets to and what you want to focus on. So Olivia Clay is supporting the back end of this webinar as always, and Olivia is going to pull out some breakout rooms for people, and we'll start with about 15 minutes and see where we go from there.
Fantastic.
Hi everyone, just letting you know that the breakout rooms have been opened currently, so you can just join the breakout room as you see it.
Olivia, I'm just working on something for Doris, so I'm just coming back to the main room, okay?
Yeah, no problem. Susan, so I just did a quick search, and I think each room has one of the staff that you've identified, so we should be good.
Thanks, Susan. I'm just working on a document for Doris, so appreciate the time.
Facility. And that's it.
That was a wonderful report. Any of your colleagues wants to add, or we move to the next?
Yeah, Loren just, she said that she would like to share a minute or two.
Hi everyone. I just wanted to make sure, just because we had so many personal stories shared that they were really heart-wrenching actually. So our first and foremost, I think that really started us off was the repeal of Bill 124 and HR crises, especially in acute care, but really all over. We then really jumped to some personal stories about long-term care and home care difficulties with family or friends. So really just heart-wrenching stories about people falling through the cracks, and what do we as nurses, but also as Ontarians, what do we do about this? If you contact your MPP and you have no response, and you try and reach out to a LIN and there's a delay or no response, what do we do? How do we advocate more? There's so many really problems that are so multi-layered. There's not an easy answer, much beyond our 15-minute conversation, but thank you everyone for sharing. And we also finished off with a really interesting discussion about housing and homelessness issues, which of course is my portfolio. So I always love discussing that. So thank you to everyone in my group. It was really very interesting and enlightening.
Great, thank you so much. So with it, Christina, your group, or Anne-Marie, your group, anything that you wanted to share before we close?
My group had a lot of interesting conversations. A lot of similar themes were echoed in my group. So a lot of concerns and some personal stories with regards to social determinants of health, homelessness, underhousing, the need for access to care and employment. Of course, the issue of repealing Bill 124 has come up. It's so important to so many of us. And some personal stories, once again, related to home care and long-term care, funding and access, stuff related to vaccines, and so many interesting conversations. I really appreciated everyone sharing their personal stories. And it was really nice to be able to hear how people are planning to get involved in this upcoming election. Things as simple as just keeping themselves informed with social media and engaging with colleagues. And some people are even committed to meeting with their MPPs and candidates in order to get more information. So this is all great to hear, and it was such an amazing discussion. So thank you, everyone.
Great, thank you. Anne-Marie, did you want to share about your group, or did you want to just speak about the all candidates meetings before we close out?
Yeah, sure. So I'll just as quickly summarize. So the main focus of our group actually was talking about care delivery and how COVID-19 has really shone a light on gaps in care delivery. So that was the main topic of discussion. And also just a segue, we were talking about great ways to be involved in the election. And somebody in the group mentioned all candidates meetings, which is what I'll be talking about quickly. And I know we're almost out of time here. So just, a great way to get involved in this election is to participate in these all candidate meetings. So chapters and political action representatives and all of the regions in Ontario are hopefully running these candidate meetings. So we get a chance to discuss Rneo's policy platform and other policy issues in regards to healthcare. So, and we've had a few, I don't know if you, oh, there we go. So we had a great one on the climate emergency that happened earlier in April. And also we've had the International Nurses Interest Group who's done one, and we have two upcoming, or Middlesex Elgin also did a great candidates meeting in participation with London Health Sciences. So that was a really great discussion about gaps in care delivery as well, and the nursing crisis within their hospital. And also we have Kingston chapter will be doing an upcoming one this week. And we also have Durham Northumberland that'll be doing their all candidates meeting. So if you're interested in learning more, you can just email me, get into contact with me. And also if you are interested in organizing your own all candidates meeting, I can help you with that as well. Thank you.
And these are all posted, Anne-Marie, in the website in a prominent place next to our own schedule, please. And if not, let's make sure that they are so people can actually go there and see both, please.
Mm-hmm.
Fantastic.
Great. So Doris, how about you provide some closing remarks for today?
Well, I want to first thank everybody for inspiring us by attending. We know that everybody is extremely busy, that people have a lot on their plate, and that people are also tired. So we appreciate that in the morning we had almost 70 people attending. In this afternoon, we had also a very, very good attendance, and that means people are interested. We want to remind you that get involved, whether it's door knocking, whether it's helping any of the 7 nurses that are running for elections, that are Rneo members, their ends, and we should put their email there and their link in case people want to connect. Later on, Anne-Marie, we can do it even tomorrow. And also, one of the colleagues in our group, in fact, several of the colleagues in my group said, speak with your neighbors, speak with your family, speak with your friends, right? It's not always, if you don't have time to go door knocking and helping a candidate, speak at least with people that are close to you. And if you don't have enough of the details of what to discuss, send them to our platform. And Marie, please put the link again. Send them to our platform and they will gain a lot out of it. Also, just to remind you, we did launch today the $50 campaign. So if you know of any nurse that either lapsed Rneo membership or is not currently a member, $50, and that includes PLP, which is mandatory by the college, professional liability protection. And remember, we have an insurance, so you get, we are mandated to protect you, we're mandated to defend you. So please join, tell your colleagues to join Rneo. We are going to finish this year, I can already say it, by about 50,000 members. We are already well over the almost 1,900 MPs. Keep going. It's the place to be at the right time for the right reasons. So celebrate even if things are difficult where you work, because in many places they are, and we heard you loud and clear, whether it's nursing homes and the shortage of staff, or whether it's emergency room or anywhere else in the hospital or home care. We know stuff. We know there was a pandemic, but there is a lot to be thankful for. First of all, you can be here. It means you're healthy. That's number one. Hopefully your family and friends, you have many of them that are healthy. That's number two. Number three, you have an association that wants to work with you, to be with you, to be on your side, and to help push the agenda, regardless of who comes after June 2nd. Number four, go and vote, because it's important, because democracy is to be cherished. And lastly, thank you for all you do. Thank you for being a nurse. Thank you to your families for sharing you with the profession and with patients wherever you work, in any sector and or in the association, for those that are at Rneo. And just a happy Nursing Week to everybody. Thank you so very much on behalf of Rneo, the board of directors, the entire staff, and the entire 48,500, which is the number we finished last year. Thank you for being a RN. Thank you for being a nurse practitioner and for being a nursing student. Thanks a lot.
Thanks, everyone. Happy Nursing Week.